region, we pride ourselves on being a national, if not a world leader in terms of quality health care. No wonder. Not only are our neighbors doing cutting-edge research, healthcare represents the largest employer around here. Yet finding and training the healthcare providers, from nurses to emergency medical technicians, is a real challenge, especially outside our urban centers. Well, now the Keystone Simulation and Education Center has stepped up to bring state-of-the-art training to Beaver County, Pennsylvania, and points beyond. Lynell Scaff is Executive Director of the center, and Linda Gallagher is Associate Vice President for Assessment and Director of Nursing and Allied Health at the Community College of Beaver County. And welcome. Good to see both of you.
Thank you. Nice to be here.
Yeah, Lynell, why don't we start with you? What exactly is a Keystone Simulation and Education Center?
It's a facility located in Potter Township in Monaca, Pennsylvania. That was a school building that was retrofitted to this simulation center. It's 24,000 square feet, and in it we do a full continuum of care, from home health care all the way up through emergency room, ICU, a Medi-Surg room, a birthing suite, pediatric neonatal, and pharmacy, blood bank, family physician offices, and task training rooms with classrooms.
Wow, pretty much everything, soup to nuts, what's required to take care of patients in this modern system.
Exactly. And also for EMS and for first responders. We are able to stage mock drills so that they're able to practice the skill sets that they will need when faced with a real emergency.
How did this come about?
The center itself was a school building that was retrofitted. The owner found this piece of property along with 22 acres and thought a simulation center in Beaver County would be actually an excellent method to help assist with the schools in their training. And the simulation provides for the region, for all of Beaver County, Butler and Lawrence County, an opportunity for these groups to come in and practice in this setting. The mannequins, and that's what they are technologically able to replicate everything you and I do. So for example, we breathe, we cough, we talk, our eyes blink, we have a pulse, we have a blood pressure. That's what all these mannequins do. And so we have different disease processes and different issues that we can put these mannequins through, from childbirth to cardiac arrest, to blocked airways, to seizures. And so you get to practice on this mannequin and figure out exactly how it is that you will handle the situation.
Pretty amazing. So Linda, is it an effective way to train nurses?
It is very effective and has become very, very popular as a learning strategy. And one of the reasons is that it provides a safe environment for students. There's a no consequence to taking care of this mannequin, and if something happens, no consequence. So they feel more comfortable then when they go to the hospital. And in the hospital itself, you know, that arena has changed over the years, where there's very short patient stays. So every patient in the hospital has a high acuity, they're acutely ill. And so for a novice coming in to that situation, if they have the opportunity to practice before, they can be more comfortable. And they are starting to do research on the outcomes of using simulation in education. And the outcomes are showing the increased self-confidence of the students, that there are fewer medication errors for the simulation, from the simulation, and they also have better assessment skills. And so we are very much in the profession using simulation now, and we are thrilled to have the simulation center in our area.
Yeah, I would think you'd find it closer to the city of Pittsburgh, Allegheny County, where all the big urban medical centers are, but to be able to offer this now in the northern part of our region is a real terrific thing.
It is, and we find that even with our community groups that come to use it, we do a lot of work with youth in our area, and we teach them basic skill sets, things that they're going to come across in their everyday life. We teach them how to dress a wound. We teach them how to give an injection, take a blood pressure, what to do if in fact there's a seizure or a slip and fall, how you handle the patient that has the injury, and how you get the help that you need to.
But I know you're trying to really do some outreach into more potential users, so who's not using this to its fullest extent that should be?
We are hoping for more home health care workers and nursing home attendants, individuals who can have the opportunity to get a good skill set and learn in a team environment how to communicate, have good communication skills, and also emergency medicine and first responders.
If you want to find out more,
contact myself at Keystone Simulation Education Center, and on the website we're at www.ksecpa.org.
Well, thank you both so much. Really appreciate it. It really is a terrific opportunity. It's going to save a lot of lives and help train people for really good jobs all over our region. Thanks so much. Appreciate it.
Thank you.
Thank you.
And we'll be back in a minute with more of our region's business. Stay with us.